Hi there, my name is Christina Diacides. I'm going to be talking to you about arthritis and how it can be addressed through the principles of exercise physiology. So first off, whenever I hear arthritis from a patient, they're always like, oh, I have arthritis, I'm always gonna hurt, or they're scared because they have a degeneration joint disease. This is right off the bat what I hear anytime arthritis comes up. And I assure the patient, okay, well, you're in the right place, because the best thing for arthritis is movement. Motion is lotion. Let's get you moving. Let's get you going. And then if they're like, well, I have a disease, then I always like to explain it to them as we age, our skin wrinkles. That's normal, right? There's no pain associated with that. And then as we age too, we get wrinkles on the inside. So the joint cartilage wrinkles up. There's a wear and tear on those joints, and it comes with everyone aging. It's part of the aging process. So I like to explain that to patients because it helps de-escalate that fear of having a joint disease. So on that topic, I will be talking about the etiology, exercise concepts, nutritional information, and the role of PT within arthritis. So today I'm going to be talking about two types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is known as that wear and tear within the joints cartilage. So with that, people risk factors for people with osteoarthritis is age. As we age, we get arthritis, joint injury or overuse, obesity, gender. Women are more likely to develop OA than men, genetics, and race. So those are some aspects of osteoarthritis. Rheumatoid arthritis is an autoimmune disease. It mostly affects the hands, the fingers, the feet, and the toes, and it's usually bilateral. So if one body part, if the fingers have it on this side, the fingers will usually have it on both sides. And the immune system attacks those healthy cells within the joints, which causes inflammation and pain. And then for rheumatoid arthritis, the risk factors for this is age. As we increase, the greater the risk for RA. Sex, gender, women tend to have it more than men. Genetics, smoking, there's been a couple studies showing that people who smoke or around smoke develop RA more. And then obesity also increases that risk factor as well. All right, so moving into some exercise concepts. So one study I found showed that fatigue within arthritis is related to increased cardiac and ventilatory systems due to poor gait mechanics. So they found that people with pain are working more during their gait because they're compensating due to the pain. So a quote from the study is, OA in the hip, knee, and ankle reduces effective exchange of potential and kinetic energy, increasing the muscular work required to control movements. So with that being said, it's going to increase the cardiac, it's going to increase your oxygen input and output, and it's going to just be tough just to walk. So training these systems is going to be important. And the study showed that effective gait mechanics and gait training helped reduce pain and also helped decrease that cardio and oxygen output. Some exercise training recommendations is that to focus on some dynamic flexibility. So stretching is important, flexibility of the joint and muscles is important, but dynamic, loading the joint, loading the muscle, but not high impact. With these patients, the more active, the better. Again, just keeping it low impact to decrease the stress within the joints. So activities such as cycling, swimming, walking in the pool, aerobics in the pool are low impact activities that these patients can join in on. So they suggested aerobic and resistance training for patients with arthritis, and they suggested that 2 to 3 days within a week are resistance training, and then 4 to 5 days of aerobic training. So that's a lot of activity for these patients, but again, motion is lotion. Moderate intensity for their aerobic exercises, and they said to gauge it with a talk test. So if we're in the clinic or they're riding their bike and they're able to talk throughout the whole 10 or however long they're going for, then they're going too light. They need to have a moderate intense workout. So if they are doing that activity, they have trouble talking. And then for resistance training, they suggested light to moderate intensity. So with that, if you have your resistance band, your weight, or however, wherever that patient's at, making sure they can perform 10 to 15 reps. No more, no less. If it's more, then you need to up the weight. If it's less, then the weight's too heavy. All right, and then just with anyone performing activities that they enjoy, individualizing each program to each patient. If they don't like the bike, don't make them do the bike. There's other options. They can walk on the treadmill, they can do the elliptical. There's plenty of options for these patients, and having them enjoy their activity is gonna be key to their success. And then for resistance training, you want to train muscles from head to toe, but also focusing on the joint that's effective. So if it's knee arthritis, focusing on the quads, the hamstrings, the gastroc, the glutes, just making sure above and below and surrounding that joint to improve that motor control. And then these exercises can be performed at home or at a gym. Of course, we always want our patients to become independent after they come to the PT clinic. So some dietary recommendations. I found an article that suggested the Mediterranean diet because it helps decrease inflammation. It helps benefit your joints as well as your heart, and then it leads to weight loss, which can lessen your joint stress and pain. So with the Mediterranean diet, there's a lot of fish within that, and that has a good source of omega-3 fatty acids, which helps decrease inflammation. Salmon, tuna, sardines, herring, anchovies, and scallops, and other cold water fish have those omega-3 fatty acids. And if people don't like fish, or your patients don't want to eat fish, studies have shown that pills of 600 to 1,000 milligrams of fish oil daily can ease joint stiffness, tenderness, pain, and swelling. Nuts are also inflammatory fighting because they're high in fat, high in calories. They promote weight loss because of their protein, fiber, and their monounsaturated fats. So those are great to have. Beans are also loaded with fiber, which helps lower the CRP, which is an indicator of an inflammation found within the blood. So, and then at high levels, CRP indicates anywhere from an infection to RA. And then also studies have shown that fiber and fiber-rich foods can also lower blood levels of CRP. So eating your multigrains can also help do that because they're high in fiber as well. The role of PT would be, if I saw a patient with arthritis, it would be to improve their motor control, their muscle strength, their joint mobility, flexibility, and improve their function and their functional skills. Again, seeing these patients, encouraging to continue to move, encouraging them to continue to do these low impact activities is going to be essential into their care and their quality of life. I have seen a lot of patients who had arthritis and have had great success with just increasing their activity, and it improves more than just their joint pain. It improves their quality of life. So arthritis is something that comes with age. Rheumatoid arthritis is an autoimmune disease which increases inflammation. Physical therapy is a great indicator for patients with arthritis because we can help decrease their joint stiffness. We can improve their mobility and their function. And then also encouraging these patients to make sure they're watching what they eat. If you have any questions, please let me know. Thank you for listening.